So how do we determine good reading, or how do we take good reading? Remember, we have identified that we have three different current components within the when we apply that potential, okay, between the insulation when taking our IR test. So this is the capacitive current. Like we said, you see that it is high initially, then it decays after a few seconds. The absorption current too, you see, it takes a longer time for it to decay because it takes much longer time for the dipole to realign, as we saw. Okay, but the capacitive current, that one takes, because once the plates that is created, so to say, we will see it later. Once it is fully charged, there will not be flow of current again. So this will dissipate or disappear within a few seconds, and then this will disappear after some seconds. Okay, so you see that once you inject your DC voltage and you rush to take readings, the reading that you will be taking will be inclusive of the effect of the capacitive current, the absorption current, and also the leakage current. And even at this point, you see that the leakage current have not risen to the full value. Okay, so this reading that you take early, because most of us will do the mistake of just putting our probe, press the injection button, the test button. As you press to inject your voltage, you just record the reading out. So that is erroneous. Okay, what you do, because of this, what we are seeing now on the screen, you allow those two, the capacitive and the absorption current, to dissipate first before you take, so that what you have is the leakage current. So you see that the absorption current is high, the total current, I mean to say, is high when you rush to take it, because you have both the leakage, the capacitive and the absorption current. So the most ideal time for you to take your IR reading after injecting your test voltage, or when doing IR test, you allow for 60 seconds to pass. That is 1 minute. It's a must. Okay, that is when you will have the accurate reflection of the insulation resistance of the equipment, okay, or the insulator that you are testing. So if you record the reading before 1 minute or before 60 seconds, what you are having will be reduced insulation. Okay, that is reduced IR because of the larger total current or higher total current. Are we getting it? Remember, R is equal to V over I. So if I is high, R will be low. Okay, but if you allow for some time to pass, the capacitive current would have disappeared, and then the absorption current will also disappear. So when that happens, what will be left is the leakage current. So when you inject, whenever you go to carry out IR test, you allow for at least 60 seconds to pass, so that all of this will disappear, and then you have a reading that is that will be a true reflection of what you have. So the test should last a minimum of 60 seconds for you to have a good test.